August 25th, 2005. Yesterday started out as any other summer day, leaving residents from Louisiana, Mississippi, and Alabama the unbearable task of rebuilding their lives. I'm Chloe Williams, reporting from New Orleans, Louisiana. Here's what we know now. Hurricane Katrina was a Category 3 storm, winds reaching 140 miles per hour. As these headlines show you, Hurricane Katrina left behind an unstable environment, shaking the core of the region's political climate and public health. As residents and disaster relief organizations work to pick up the pieces, authorities are warning everyone they are at risk for West Nile virus. Take a close look at this picture. That's all water. Nearly 80% of the city is under some quantity of water. In fact, the National Weather Service predicts that most of the Gulf Coast affected by Katrina will be uninhabitable for weeks. And where there's a lot of water, there is potential for West Nile virus. That makes New Orleans, who got hit the hardest with the most flooding, particularly vulnerable. West Nile virus is spread to people by mosquito bites. Mosquito season starts in the summer and continues through fall. And since it's August, that makes people living in this area a prime target. With mosquito-borne illnesses especially, people should be aware of a delayed effect. In the short term, after a hurricane, there should actually be a lower risk of contracting this virus because the water likely washed away the existing breeding sites. However, mosquitoes could be laying eggs for future outbreaks. West Nile encephalitis is an infection of the brain that is caused by a virus known as the West Nile virus. It was first identified in Uganda in 1937 and then made its way to North America in New York City, where the first case was identified in 1999. Before the outbreak and during its peak, the New York City Department of Health noticed the rate of human encephalitis aligned with the rate in which birds were experiencing a high fatality rate. For nearly a decade, this virus has been a major health concern for the United States. West Nile virus is a flavivirus and is related to dengue viruses and yellow fever. West Nile is an arbovirus, which means it's arthropod-borne. Mosquitoes carry it in their salivary glands, and humans get it from mosquito bites. The virus spreads in the lymphoid tissues and circulates in the bloodstream before reaching the brain, which is called encephalitis. Birds are a great reservoir host for West Nile virus because they contain high levels of the virus. So when an infected mosquito bites an infected bird, it can pick up the virus easily. We are dead-end hosts because mosquitoes can never get infected from us. What's concerning is that someone can have West Nile virus and not even know it. The U.S. Centers for Disease Control and Prevention say about 80% of people infected with West Nile do not develop symptoms. Symptoms start to develop between 3 to 14 days after a mosquito bite. If you're noticing any symptoms, talk to your doctor. So how can you protect yourself? Use insect repellent, wear long sleeves, avoid going outside at night when mosquitoes are most active, and try to get rid of standing water around your house or apartment. Wet, murky areas are where mosquitoes like to lay eggs and breed. More than 700,000 people in New Orleans live in mobile homes. Living in a mobile home makes the poor extremely vulnerable for water retention and home damage. And where there's pools of water, there's risk for West Nile virus. And even if the poor do get West Nile virus, they don't have health insurance for treatment. The 26,000 New Orleans residents seeking shelter in the New Orleans Superdome are also vulnerable. Disaster relief officials are trying to keep them hydrated and fed while trying to keep the area sanitized. Katrina is quickly changing the state's political climate. Right now, experts predict the storm will cost about $100 billion in damage and disaster relief. FEMA, the Federal Emergency Management, is taking most of the hit from residents and city officials who are demanding faster action on relief efforts to help a city overwhelmed with financial, physical, and emotional loss. Government and health officials, especially President George W. Bush, are being blamed for not realizing the full extent of Hurricane Katrina's aftermath. Making a West Nile virus vaccine is no easy task for scientists and medical experts. The T cells and B cells that recognize and build a response against West Nile virus do not recognize or respond to equine eastern encephalitis virus. And there is no immune memory, a characteristic of the adaptive immune response that remembers pathogens and how to defeat them. Without immune memory, a vaccine cannot be successful. There is hope that Katrina can motivate the science community to continue to make a vaccine, which officials say can be coming soon. Vaccines are currently being tested on horses. Only time will tell for Hurricane Katrina victims, but for now the state is doing all it can to keep Katrina victims safe and prepared for the uncertain future in a country faced with the growing threat of West Nile virus.